I'm going to be testing the olfactory nerve, which is for smell. So I'm going to have them close their eyes and cover one nostril. So we're going to smell this first. Garlic. Okay. And the second one. Hot sauce. And you would do that on both nostrils. And if they can't smell it, then that would mean one of the nerves is damaged. But if they can smell it, then they're intact. The next cranial nerve I'm going to be testing is the optic nerve, which is the second nerve. And it's for vision. So you can have them look at a Snellen chart and cover one eye, or you have them stare at a spot on the wall in front of them and you cover one eye. And whenever you see my finger, tell me. Yes. 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 Now you cover the other one. Looking back at the spot. Yes. 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 Okay. So if they wouldn't be able to see your fingers until they were really far out, then you would assume there is damage to the optic nerve. Next I'll be testing cranial nerve 3. It's for the ocular motor, and it tests for eye movement and pupil reaction. So you can have them do the Snellen chart like before with optic, and you can also do the peripheral like we did with optic. And you also want to check their pupil dilation. So you go and you look forward and you test, bring your light in. And then you want to put your hand here and separate and see it. And if they don't have pupil dilation, or they can't see when you do the peripheral, or they cannot see the Snellen chart, then you would assume there is damage to the ocular motor nerve, and if they don't have symmetrical pupils when you are doing the dilation. Next, I'm going to be testing for cranial nerve 4 and 6. 4 is the trochlear, and 6 is abducens. And with trochlear, it is eye movement, and it's for depression of the eye and adduction. And with abducens, it's for abduction. So you're going to test it by going in an H without moving your head. So you're going to follow the pen with your eyes. So you can go over. And if they have any trouble when they're looking down and the affected eye starts to go up, that is damage to the trochlear nerve. And if they have experiencing of double vision, that's also with the trochlear. And then for abducens, if they're looking out and their eye starts to go in, that is for the abducens. So there's damage to the nerve 6. The next nerve I'm going to be testing is cranial nerve 5, which is trigeminal. And that is for face sensation and mastication. So to test their mastication, you want to palpate on the masseter and clench your teeth. And you want to feel an even and like make sure it's also clenching at the same time. And then you can also have you resisting the depression of the jaw. Good. And then for face sensation, you want to poke at their face and see if they can feel it. So close your eyes. Do you feel that?
Yes. 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 Yes.
You also want them to keep their eyes closed and make sure that they can feel it the same on both sides. So, does that feel the same?
Yeah. Yes. Yes.
Okay. So if they would have uneven symmetry when doing mastication or was unable to depress the jaw, that would be a damage to the trigeminal nerve. Or if they didn't feel the same, or they couldn't feel when you were poking on their face, then that would also be damage to the cranial nerve 5. The next one we're going to test is cranial nerve 7, which is facial, for the facial muscles and for taste. So to test this, you're going to have them close their eyes and smile. And you're looking for if that's asymmetrical and if there's drooping of one side. And you can do other faces too. So you can do anything that's symmetrical. And then you want to You want to test taste. So we have two. So you're going to do salty and something sweet. So you want to keep your eyes closed. And for the first one is this. So open. Is it salty or sweet?
Salty.
Salty. Okay. This is the second one.
Wholesale.
Wholesale. Got it. You tell me when you're ready.
Okay, hold on, it's stuck.
Okay, ready for the next one? Open. And that's what?
Sweet.
Okay, so if they can't detect the difference between salty or sweet, or they can't taste anything, that is also damage to the cranial nerve 7, as well as the asymmetricalness of the face. The next cranial nerve I'm going to test is cranial nerve 8, which is vestibular-cochlear, and it's for hearing and balance. So you're going to have them close their eyes, and I'm going to snap, and you can raise your hand on which side it is. Okay, and if they don't react to that, or they say the other side, there might be damage to the cranial nerve. And then you also can have them stand up and put your feet together, hands on your hips, and you want to stare off at one point on the wall, and you're going to hold that for 5 seconds. So 1, 2, 3, 4, 5. You're also going to do it with your eyes closed. Okay, and then 1, 2, 3, 4, 5. Okay, sit down. And if they lose their balance, or you can notice them going like back and forth, that is also going to be damage to cranial nerve 8. I'm going to test the cranial nerves 9 and 10. 9 is glossopharyngeal and 10 is vagus. And that has to deal with swallowing, voice, and gag reflex. So for swallowing, I would notice how when they swallow, if they have hard time swallowing, if they have pain, or if they can't swallow in general. Did you have any of that?
No.
And then I would say to look at their voice, I would have them stick out their tongue and say ah.
Ah.
And then for gag reflex, I would use a tongue depressor to test it, but I don't. So I'm going to look at the uvula and see if it's off-centered, or if like the soft palate's off symmetry, but she doesn't have that. So, but if they did, they would have damage to cranial nerves 9 and 10. The next cranial nerve I'm going to test is cranial nerve number 11, which is the accessory nerve, and it's for the sternocleidomastoid and the traps. So to test that, I would have them do a shoulder shrug, and if they can't do that, or only one side does it, then I would assume that they have damage to cranial nerve 11. The next cranial nerve I'm going to test is cranial nerve 12, which is the hypoglossal, which is for tongue movement. So I would have them protrude their tongue, and keep it out. And I would notice if it is in line, but if it is only going to the affected side, then I would assume there is damage to cranial nerve 12.